It may sound surprising, but regular consumption of certain types of nuts can significantly increase the risk of developing cardiovascular diseases by as much as 48%, especially among older adults. There is a rational basis for this assertion, confirmed by a long-term study published in the Journal of the American College of Cardiology. The harsh reality is that some of the most common nuts, which are usually stored in the kitchen, can subtly raise blood pressure, provoke inflammatory processes, contribute to arterial blockage, and even exacerbate cognitive decline. At the same time, many elderly people eat them, mistakenly believing that they are beneficial to their health. One particular type of nut, the name of which will be announced later, contains a high concentration of a toxic substance that, with systematic use, can cause serious harm to the liver, kidneys, and cognitive functions. This nut is probably already in your snack jar, and it is often recommended as a healthy product for those who follow a low-carb diet. However, as it turns out, it can cause irreparable damage to an aging body. So, which nut poses a hidden threat? You will find out the answer to this question by watching until the end. Don't worry, because this material will provide a comprehensive guide to the world of nuts. The reader will learn which of them are the safest for health, which bring the greatest benefit to the cardiovascular system, and which stimulate brain function. In addition, information will be revealed about nuts that should be avoided at all costs. It is important to read to the end, as there is a little-known but bitter truth about the most dangerous nut, which can cause serious harm to health while remaining unnoticed. So, here are 4 types of nuts that are especially beneficial for older adults. First of all, these are almonds, a storehouse of substances that strengthen bone tissue. Almonds are one of the best foods for an aging body, as they are rich in calcium and vitamin E, which together support bone strength. With age, fractures become more dangerous due to the fact that bones become more porous and fragile. After 65 years, the natural loss of bone mass accelerates, but eating just 1/4 cup of almonds a day can slow down this process, providing the body with approximately 97 mg of calcium. Almonds are not only a storehouse of calcium, but also a valuable source of magnesium, an element that is often lacking in the diet of older people, which makes it a truly unique product. Magnesium plays the role of a kind of transporter, protecting the arteries from calcium deposits and directing this important mineral directly into bone tissue. In addition, monounsaturated fats, which are so rich in almonds, have a beneficial effect on the cardiovascular system, helping to reduce the level of bad LDL cholesterol, which is especially important in old age when the risk of heart disease increases. Experts recommend that older people include 15 to 20 almonds in their daily diet, preferring raw or dry roasted, without added salt. Almonds are also an effective remedy in the fight against constipation due to the high content of fiber, about 3.5 grams per serving, which is relevant given that about 40% of older people face this problem. It is important to note that studies conducted by scientists from Tufts University have shown that almonds can prevent oxidative damage to brain cells, which is one of the main causes of cognitive impairment in old age. For maximum benefit, it is recommended to eat almonds with the peel, since it contains flavonoids, which, in combination with vitamin E, enhance the antioxidant properties of almonds by 2 times. It is worth remembering that almonds can be dangerous for older people who have difficulty swallowing, so they should be chewed thoroughly. Walnuts, thanks to their striking resemblance to the brain, are considered one of the best foods for maintaining cognitive function in older adults. These nuts are the richest plant source of alpha-linolenic acid, an omega-3 fatty acid that plays an important role in neurotransmission and maintaining the integrity of brain cell membranes. Studies have shown that daily consumption of only 40 grams of walnuts for 2 months can significantly improve the speed of cognitive processing and mental flexibility in older adults. A new study published in the journal Nutrition suggests that the unique polyphenols found in walnuts are able to penetrate the blood-brain barrier and fight inflammation in nerve tissues, preventing the development of neurodegenerative diseases such as Alzheimer's disease and dementia. Walnuts also contain melatonin, the levels of which decrease with age, which can lead to sleep problems. Some people find that eating a handful of walnuts before bed helps them improve their sleep quality. The combination of arginine, an amino acid that promotes blood vessel function, and polyphenols, which reduce oxidative stress, makes walnuts incredibly beneficial for the cardiovascular system. They can enhance the effect of blood pressure medications, helping older adults maintain the elasticity of their arteries. For maximum benefit, it is recommended to store walnuts in the refrigerator to prevent their delicate oils from going rancid, and to consume 7 to 9 walnut halves per day. As an additional exercise to maintain fine motor skills, you can crack the nuts yourself. Don't be put off by the slightly tart taste of walnuts, as this bitterness is a sign of high antioxidant content. Secondly, pistachios should be mentioned as an effective tool in maintaining healthy blood pressure. In the context of the health benefits of nuts for older people, pistachios may be underestimated, especially in matters of blood pressure regulation. The uniqueness of these nuts lies in their low sodium content and high potassium level, about 285 mg per serving, making them an excellent choice for a snack. This balance of minerals is especially important for older adults, as it helps prevent salt retention by the kidneys, which often occurs with age. Regular consumption of pistachios can reduce systolic blood pressure by 3 to 5 points, which is comparable to the effect of some prescription drugs, but without any negative side effects. In addition, it is worth paying attention to lutein and zeaxanthin, which are contained in pistachios. These carotenoids play an important role in protecting against age-related macular degeneration, a leading cause of vision loss in people over 60, due to their ability to concentrate in the macula of the eye. Older adults can enjoy the pleasant crunch of pistachios without worrying about the potential harm that other, harder nuts can cause to their teeth and gums. In addition to aesthetic pleasure, the bright green and purple hues of pistachios indicate the presence of antioxidants that effectively fight free radicals, slowing down the aging process in the body. Pistachios are an ideal choice for older adults due to their unique feature, the need to be shelled, which promotes moderation in consumption and creates conditions for conscious eating, which has a beneficial effect on cognitive functions. The process of extracting the kernel from the shell naturally slows down the rate of consumption. Studies published in the International Journal of Obesity have shown that the visible empty shell serves as a visual signal, helping to control the amount eaten. For those who suffer from arthritis, there are pistachios with semi-open shells, allowing you to enjoy their benefits without extra effort. The recommended daily intake is about 49 pistachios, which corresponds to approximately 30 grams of unsalted or lightly salted kernels. For 25% of Americans over 65 who suffer from diabetes or prediabetes, the high fiber content, 3 grams per 30 grams, in pistachios has a positive effect on regulating blood sugar levels. At the top of the list of healthy foods is the Brazil nut, a true ally of the thyroid gland. This gift of nature is awarded first place due to its beneficial effect on the functioning of the thyroid gland, an organ that plays a key role in the process of healthy aging, but often remains without due attention. Surprisingly, just one Brazil nut contains 96 micrograms of selenium, which is 137% of the body's daily requirement. This makes it the richest natural source of this valuable trace element. The importance of the Brazil nut cannot be overstated, given that many thyroid diseases remain undiagnosed, and their symptoms are mistakenly attributed to natural age-related changes. According to statistics, up to 20% of people over 65 face problems with the functioning of this endocrine organ. Selenium, which is abundant in Brazil nuts, plays a vital role in activating thyroid hormones, which in turn support energy balance, regulate metabolism, and affect mood. In addition, the unique fatty acids that make up Brazil nuts help preserve myelin, the protective sheath of nerve cells, which degrades with age. By maintaining the integrity of myelin, Brazil nuts help older people maintain sharp reflexes, reaction speed, and cognitive functions. The fact that selenium in Brazil nuts is in an organically bound form is particularly noteworthy, as this ensures high bioavailability and facilitates absorption by the body compared to synthetic supplements. Brazil nuts have such a powerful effect that even a small amount can bring tangible benefits. In addition, their rich, creamy texture makes eating these nuts a real pleasure. Experts strongly recommend that older people exercise moderation in the consumption of Brazil nuts, limiting themselves to 1 or 2 nuts a day. This is due to the risk of excessive accumulation of selenium in the body, which can lead to undesirable consequences. When buying these valuable fruits, it is recommended to give preference to nuts in the shell, since such natural packaging helps to preserve nutrients for a longer period. Due to the high fat content, Brazil nuts require special storage conditions, namely in the refrigerator, to prevent premature spoilage. The unique combination of fiber and natural oils in these nuts has a beneficial effect on the intestines, helping to maintain their regular function. This is especially true for older people prone to constipation. Brazil nuts can be a great alternative to less healthy snacks that older people often resort to. Their natural sweet and oily taste makes them an attractive and healthy choice. Recent studies indicate that the antioxidants contained in Brazil nuts have the amazing ability to slow down the shortening of telomeres, protective caps on the ends of chromosomes, which tend to decrease with age, which in turn affects the aging processes of cells. Thus, Brazil nuts can be a valuable addition to the diet of people aged 65 and older, helping to maintain health and slow down the aging process. In this section, we will turn our attention to the world of nuts, focusing on those varieties that older people should treat with caution or avoid eating altogether. The fourth trigger of inflammatory processes in the body is peanuts. Despite its widespread use in the food industry, peanuts pose a potential threat to the health of many older people due to a number of factors. First of all, it is worth noting that peanuts, contrary to popular belief, are not a true nut. It belongs to the legume family and grows in the ground, which makes it vulnerable to mold and aflatoxins. Aflatoxins, in turn, are mycotoxins produced by certain types of mold that can harm the liver and increase the likelihood of developing cancer if consumed regularly. With age, the body's detoxification mechanisms inevitably weaken, which leads to an increased risk of negative effects from aflatoxins. However, this is not the only cause for concern. Peanuts contain specific proteins that can cause inflammatory reactions in some people, even in the absence of a peanut allergy. Older people are known to be more susceptible to the risk of developing joint discomfort, cardiovascular disease, and cognitive impairment. In this regard, even a slight inflammation caused by eating peanuts can worsen the course of these diseases. In the modern diet of the average American, there is a noticeable imbalance in the consumption of fatty acids. Omega-6s, which are already in excess, significantly outweigh beneficial omega-3s, which have anti-inflammatory properties. Eating peanuts, which are rich in omega-6s, only exacerbates this problem. Unfortunately, many medical professionals overlook an important aspect: the interaction of peanuts with blood-thinning drugs, such as warfarin. Vitamin K contained in peanuts can interact undesirably with these drugs, which is especially dangerous for elderly patients. Commercial peanut butters, abundant in hydrogenated oils, excessive amounts of sodium and sugar, pose an additional threat to cardiovascular health, especially in older people. Considering that 63% of older Americans suffer from hypertension, they already have enough to worry about. Even natural peanut butter, which does not contain added salt, can raise blood pressure. Improper storage of peanuts can lead to rancidity and the formation of dangerous free radicals. In addition, the widespread practice of dry roasting peanuts on an industrial scale promotes the formation of acrylamide, a chemical that can potentially negatively affect cognitive functions. This is especially true for people concerned about memory loss. Even if you regularly consume peanuts and haven't noticed any obvious negative effects, it's worth considering replacing this product with other more beneficial nuts at least 3 times a week. This measure will allow you to obtain the necessary nutrients while minimizing the impact of harmful substances contained in peanuts. Thirdly, it's worth paying attention to cashews, whose insidious effect on blood sugar levels is not always obvious. Due to their high carbohydrate content and glycemic index, these nuts pose a hidden threat to the health of older adults. Unlike true tree nuts, cashews contain less valuable dietary fiber and significantly more carbohydrates, about 9 grams per ounce. Considering that approximately a quarter of people over 65 suffer from diabetes and almost half are in a pre-diabetic state, consuming cashews can trigger dangerous spikes in blood sugar levels. Of particular concern is the fact that cashews have a reputation as a healthy product, which prompts many older adults to consume them in excessive amounts without thinking about the potential impact on blood glucose levels. In addition to this, the smooth and curved shape of cashews creates a risk of choking, especially for people with swallowing problems. Statistics show that cashews are one of the most frequently aspirated nuts among older adults. From a nutritional point of view, cashews are also not an ideal choice. They contain a large amount of oxalates, substances that can bind to calcium in the intestines, preventing its absorption. This presents a serious problem for older adults who are already at risk of developing osteoporosis. For people already predisposed to kidney stones, the risk increases significantly after the age of 60 due to the same oxalates. There is another hidden problem associated with cashew processing. During the lengthy processing required to remove urushiol, a toxic substance also found in poison ivy, cashews lose a significant portion of their nutritional value. Often, the options offered in stores are roasted in oil and generously sprinkled with salt, which adds harmful fats and sodium, capable of negatively affecting blood pressure and creating additional stress on the cardiovascular system. Cashews contain enzyme inhibitors, which can make it difficult to digest proteins. This is especially true for older adults, who often have difficulty digesting food and absorbing protein. Many consumers are not aware of this fact. The soft, creamy texture of cashews, which promotes overeating, can become a factor in weight gain during a period of life when maintaining a healthy body weight becomes increasingly difficult. As a healthier alternative, posing less of a threat to the aging body and possessing superior nutritional properties, it is recommended to regularly replace cashews with walnuts or almonds. Despite their delicious taste, macadamia nuts harbor a hidden danger to the health of older adults due to their exceptional calorie content. This nut is a real record holder in terms of calorie content, with about 200 calories per ounce. With age, the metabolic rate inevitably slows down, creating additional difficulties in maintaining a healthy weight for older adults. The already weakened gallbladder function is exacerbated by the extremely high fat content in macadamia, reaching 22 grams per ounce. In 15% of older adults suffering from asymptomatic gallstones, the consumption of these nuts can trigger painful attacks that might otherwise go unnoticed. In addition to their high calorie content, macadamia nuts are characterized by an increased content of saturated fats, about 3 grams per ounce. These fats can contribute to raising the level of bad LDL cholesterol, which is a serious problem for many older adults. The hard and dense structure of macadamia nuts poses a significant threat to the oral health of older adults, especially those with crowns, bridges, or weak teeth. This problem becomes especially relevant for people over 65 when tooth enamel weakens due to natural wear and tear and decreased calcium absorption. In reality, macadamia is undoubtedly one of the most expensive nuts on the market. This circumstance may prompt older adults seeking to control their expenses to choose more affordable alternatives. However, such nuts are more likely to be rancid or stored improperly, which puts them at risk of consuming oxidized lipids, posing a danger to health. The nutritional value of macadamia nuts, widely available for sale, leaves much to be desired. Furthermore, manufacturers often exacerbate the situation by adding excessive amounts of sodium and damaged lipids through oil frying and oversalting. Macadamia nuts have a rich, buttery flavor that can trigger overeating, especially among older adults whose taste preferences may become less refined over time, leading them to favor more pronounced flavors. It is concerning that many older adults consume macadamia nuts, believing they are supporting their heart health. However, scientific studies demonstrating the benefits of nuts for the cardiovascular system often ignore or underestimate the role of high-fat nuts, which include macadamia nuts. In contrast, pistachios have a significantly richer nutritional composition that is particularly beneficial for the aging body. Therefore, if you regularly consume macadamia nuts, it may be worth considering switching to pistachios as a healthier alternative. Pine nuts, known in certain circles as drug destroyers, pose a particular problem for older adults due to a number of factors that require close attention. One of the main reasons for concern is the presence of chemical compounds that interact with more than 60% of the medications commonly prescribed to older individuals. This means that the effectiveness of vital medications may be reduced, or undesirable side effects may occur, endangering patients' health. It is well known that many prescription drugs can interact negatively with each other. However, in the case of pine nuts, this is especially relevant for yeast. Statins, certain antidepressants, and blood pressure medications, drugs that are often prescribed to people over 65. Unfortunately, most doctors and pharmacists do not deem it necessary to warn their patients about the potential risks of food-drug interactions, which is a serious concern. Of particular note is the so-called pine nut syndrome, a condition in which a persistent bitter metallic taste appears in the mouth after consuming these nuts, lasting for several weeks. At first glance, this may seem like a minor inconvenience, but for older adults, it can have serious consequences given the close relationship between changes in taste and decreased appetite, leading to a deterioration in nutritional status. Studies show that significant weight loss is observed in 42% of people who experience this problem. It is believed that pine nut syndrome is more common among older adults, which may be related to age-related changes in taste receptors and detoxification processes in pause. The body. These factors make older adults more susceptible to the negative effects of pine nuts on their health and overall well-being. Siberian cedar kernels, commonly known as pine nuts, are high in polyunsaturated fatty acids. These compounds, unfortunately, are prone to rapid oxidation, resulting in the formation of chemicals that trigger inflammatory processes in the body. This fact may pose a certain danger to older people whose bodies are already weakened by inflammatory diseases such as arthritis. The small size and smooth texture of pine nuts create a risk of aspiration, that is, the entry of a foreign body into the respiratory tract. This problem is particularly relevant for older adults who have difficulty swallowing or suffer from dry mouth caused by medication. According to statistics, more than 70% of older adults taking multiple prescription medications face this problem. With age, the body's ability to effectively absorb proteins naturally decreases. Enzyme inhibitors found in pine nuts can further hinder the process of protein digestion, exacerbating this problem. Pine nuts are a fairly high-calorie food which can contribute to weight gain, especially after age 65. The high oil content in these nuts, as well as their frequent use in combination with other products, such as in pesto sauce, makes them potentially dangerous for people trying to control their weight. Alarming signals are coming from scientific circles. The latest research has revealed a link between certain chemical compounds present in some varieties of pine nuts and the risk of accelerated development of age-related macular degeneration. This disease, unfortunately, is the leading cause of vision loss among older adults. Experts strongly advise individuals over 65 to exercise caution and possibly eliminate 4 specific types of these nuts from their diets. Dietary choices, particularly the decision to include or exclude certain nuts, can significantly impact a person's health, energy levels, and cognitive functions in later life. It's important to remember that even minor, consistent dietary changes can yield substantial long-term benefits. Consequently, the question arises, is there compelling evidence that dietary adjustments, such as adding or removing specific types of nuts, truly have a tangible impact on a person's health? What type of nut, in your opinion, has had the greatest impact on your life? We invite readers to share their thoughts, personal stories, and considerations in the comments section. Your input is valuable and can enrich the overall understanding of this important topic.